Welcome to Logic Medicos. Today's interesting topic is doctor-patient communication skill. There is an acronym called as ADIT. In ADIT, A stands for acknowledgement, I stand for introduction, D for duration, E for explanation, and T for thank you. So we'll see each one of this in detail. So what is acknowledge means? So another patient has come seeking for you. So you have to greet the patient with a smiling face. That shows your confidence and you are acknowledging that they have come to you for seeking for help, and you are reducing the anxiety and building a rapport with the patient. So always greet the patient, keep your ego aside and greet the patient with a smiling face. That is acknowledge their concerns and therefore greet the patient. And I stand for introduction or introduce yourself, your name, what is your experience and what is your position in this hospital. Also tell about your fellow colleagues who are next to you, introduce them also. That helps in building a rapport with the patient, and also confidence of the patient is built upon you, so they will open up more and they are going to express their concerns. So this also reduces the anxiety, because the patient is meeting a random stranger now. Just by seeing the name of the doctor, they will not know who the doctor is. So if you greet and smile and introduce yourself, it builds a better rapport and reduces the anxiety and the barrier from the patient and the relative side. So that is the importance of acknowledging and introducing yourself with a smiling face. D for duration. You should always tell the patient how much duration of stay, if at all hospitalization is required, how much duration of stay is required in the hospital, and why hospitalization is required. It is for their own benefit and their own health recovery. Also, if at all you are doing a daycare treatment, if you send the blood sample for investigation, when the report is going to come, approximate time duration, 6 hours or by evening, something like that. So you should be able to tell the duration of the time taken for the reports to arrive, or the duration of stay in the hospital. You have to build a rapport. So all these are communication skill. They are subtle things which nobody will teach in medical field, which you should learn by experience. So this is D for duration. E for explanation. Whenever you are trying to tell a patient why this particular treatment is required, what are the treatment options, we should always explain the patients the advantage and disadvantage of each technique. Let it be medical or surgical. Especially surgical requires a greater degree of explanation, because the patient is anxious about the surgery. So once you explain the intricate details of the surgery, the patient is able to understand you. That builds once again a confidence, and the patient will be ready to get it operated under you. So you should be able to explain the patient. Don't think that the patient is a lay person and there is no need to explain the surgery. Get this surgery done. Don't do dictatorship as a doctor. You should always acknowledge the other human being and explain the condition to the patient, and we should be able to convince why that particular treatment is required. Let it be medical or surgical. But if you explain, again it shows your confidence and it builds the confidence in the patient as well, and they'll be ready to agree for that particular treatment option what you have explained. Always we should give the autonomy to the patient. If what treatment options are available, like 3 options are there, like medical line, chemotherapy, radiotherapy, or surgical line of treatment for a cancer or a carcinoma, then the autonomy has to be given to the patient and the relative. Whichever treatment they choose, we should give. Sometimes the autonomy will not be there when the patient is unconscious. So we should explain the condition of the patient, severity of illness of the patient to the relatives, and they will decide the treatment option. All this is done by a better communication skill from the doctor, that is a better explanation. Lastly, don't forget to thank the patient. Okay, wish the patient a speedy recovery, and if at all OPD cases are coming, in the end acknowledge. In the beginning you greet the patient, in the end just tell thank you for choosing you as their family physician or the treating doctor. So that will build once again the confidence in the patient, and subsequently the patient is going to follow up with you because you are grounded to earth. So don't forget to thank the patient in the end of consultation or communication skill. Thank you for watching and learning from Logic Medico. Kindly subscribe if you are new to our channel. Don't forget to like this video and share this video with your other friends too. Thank you once again.